I'm Ron Klopfanstein in Utica, where people have gathered to protest what Trump calls the big, beautiful bill. It was passed earlier today by Republicans in the House of Representatives. Alena, who works in maternity, and so you have obviously some concerns about these cuts to Medicaid, I imagine?
I do, because one of the first programs to be cut from hospitals in rural areas like here is maternity. So anything that's extra or they believe that doesn't need funding, and we're already a very underfunded program, it's one of the first things to go. And if we don't have anyone to deliver babies, it's going to be a really hard struggle for our moms and anyone who wants to have children.
So where would the hospitals locally, like, where would they lose these services? Would local hospitals?
Local hospitals would. Rome would eventually lose it. They would
So
probably
Rome
be one of the
Hospital would be
first. Probably one of the first to be affected would be Rome Hospital. Wynn might follow after. They
So
really
when
haven't
people talk
gotten
about
good funding.
rural hospitals, they not only could mean local they not only mean local hospitals, but like Rome Hospital, like right here.
Yeah, it
'Cause
would
we
be.
don't think
It
of
would
that
be
as a
very
rural
local.
area. So
It's a very small hospital, and we rely mostly on funding from the community. And if we lose that, we lose maternity.
so what
We
would
might also lose elective surgeries.
what would that be like for people that live around here?
It would affect people in a devastating way, because we deliver between 600 and 700 babies a year, and that's how many people would be immediately affected, especially people that come back to have children in succession. Most of our moms aren't first-time moms. They're on 4 or 5.
So
And it's a very poor area, so they rely on it because they also have access to Medicaid programs and have MVP insurance. They don't always have private.
where would they go?
There's not an outlet for it. There's not a better outlet. They would have to commute very far. Most of them don't have the resources to do that, and sometimes we have very low literacy levels, and they need rides to the hospital even from local areas as close as Canastota.
So women locally, if they go to Rome Hospital now for maternity, may not be able to get maternity services at all. They won't be able to access it.
They might not, and I don't know that Wynn would keep them if Rome lost them. And the closest would be Crouse, because they have the most funding and they actually do have a NICU. Rome can't even help babies that are born prematurely.
So and if someone is on Medicaid, likely they have transportation issues too. So getting to Syracuse would be quite a burden.
There's very limited access to Medicaid transportation, especially if people are young and have access to their families. You have to petition it and you have to ask Medicaid and Medicare for that access, and they restrict it without a very good reason. And just not having a car is not a good enough reason.
What is the potential danger of women going back to having to have their children like at home or on their own without health care?
We have a lot of high-risk pregnancies in the area. We have, well, first of all, a high incidence of obesity and diabetes, and that creates incredible complications for our moms. Without access to really good, healthy food, parents are choosing the cheapest thing they can, which is not necessarily healthy, which contributes to obesity. And that is one of the biggest factors we have with moms in high-risk situations that rely on these hospitals for care and for transfer.
So someone who's not getting their maternity services health care, they're also not going to get their health care for all the other
No, especially not if they have chronic illness.
In Oneida, Herkimer, and Madison counties, 105,000 people rely on Medicaid. There's nearly 1 in 4 residents. That means that cuts to Medicaid not only threaten to strip a quarter of Mohawk Valley residents of their access to health care, it means that our hospitals and health clinics are about to lose a significant portion of their funding. I'm with Ed and Candace. Ed is a doctor. Candace is a nurse practitioner and a nurse midwife. I'm wondering, how do you think local people will be affected by the cuts to Medicaid?
Well, our big concern is the community health centers, and there's a community health center in Utica,
Upstate Family Health Center.
How will that be affected, do you think?
Well, anybody who loses their Medicaid would still need to have health care, so they would show up at their primary care person at the health center, and there'd be no payment. They'd have to pay themselves, which would be a much reduced amount. And so the local community health center could lose a significant amount of their revenue. And in some rural areas, that is so much that they could have to close. Now, I'm not sure what the financial situation is here in Utica, but depending on how fine of margin they have, even a small amount of decrease could be devastating to them.
Yeah, and there are a lot of people in this community who have Medicaid, and if they lose that, then, as Ed just said, then they either have to pay themselves or they put off getting health care. And my concern about that is that when people don't get regular primary care services, it becomes more expensive because they wait. They wait until things are really bad, and then they show up in the emergency room and they need much higher level care, which is more expensive, right?
And what would be the cumulative impact on the industry if everybody waits until things are at an emergency state and such a large segment of the population is getting their primary health care from ERs?
Yeah.
What impact will that have on
Well, what happens is, let's say, for example, you have hypertension, high blood pressure, or diabetes, and you stop taking your medicine. You're not under control. Then you end up having a stroke, you end up having a heart attack, you end up having amputations, much higher cost and much more devastating for that individual. They can no longer work, they're not productive for their family, et cetera, et cetera. So there's a huge ripple effect.
Do you have personal concerns about the cuts to Medicaid too?
I do. I have chronic illness. I have systemic lupus. I've had it all my life. I struggle with energy levels, with fatigue, and with rash. And getting to work is a challenge for me, and getting the right kinds of medication is a challenge because there are not alternatives to biologics for someone like me who's trialed on other medications and failed. So if I don't get Benlysta, I could go into liver failure and die because my medication controls my liver failure.
I think there are probably a lot of people are going to hear this and be surprised that somebody who has a job is on Medicaid.
Yeah, I don't make a living wage. So I'm not afraid to say that on camera, that I work at Rome Health and don't get a living wage.
And a lot of people who work full time or work multiple jobs don't make a living wage and can't afford health care.
No, and most of the people in my hospital have to look for alternative services or apply for intermediary programs like I do, where you're in a category where it's not totally free and there's a partial payment plan. But for my medications, I can't afford the partial. I can't even afford the infusions if I do a partial. So I'm on the fully funded program because of my illness.
What do you think your life would be like without Medicaid and without the health care that you're getting now?
So when I moved to New York, I didn't have any health insurance and I was almost completely disabled. I couldn't get out of bed. And when I started getting on the medication, I started having control of the symptoms for my autoimmune disorder. And then I was able to get up and get a job. And I am educated. I have 2 degrees, but it's not helping.
So because you're on Medicaid and you get the health care, you're able to work.
Yes.
Let go because I was told by my doctor, no more. Don't teach ceramic art anymore. You're killing yourself. So I got $380 a month. My rent was $325. I had to go for work at the county in Bath, New York. I was in Steuben. There's a room full of people. They had one job, a part-time at a Bill Evans or whatever, that food restaurant.
Oh, yeah.
How can you pay for gas to go 20 miles to work part-time and still have money for your rent working part-time? It's this working that they're going to replace to get your Medicaid, to get your benefits. These people, no, their doctors tell them don't work. You are not able to work full-time job or part-time. So they're not taking advantage. There's no taking advantage. There might be 1/1,000,000%, but they check us every month.
And let's just back up a little bit. We're one of the few countries in the world that doesn't have universal health care. Right?
There you go.
So we're already at a huge deficit in this country. We're way behind in primary care and specialty care. So we're taking a bad system and making it worse.
And going backwards.
We're going backwards. We're going
The people here at the rally all noted that this will have a devastating impact on healthcare, whether you're a Medicaid recipient or not. In Utica, I'm Ron Klopfanstein for 95.5 FM, The Heat. This is Ron Klopfanstein. Meet me in the hot seat every Monday at 5 p.m. for Hot Seat Media Mondays on 95.5 FM, The Heat.